Going on a vacation this summer? Well, something might be waiting for you in your hotel room. Bed bugs. Bed bugs are back and in full force, and we have this report from the Journal of the American Medical Association.
The phrase, "good night, don't let the bed bugs bite," is based a little more on reality these days.
There's a tremendous increase in bed bug incidents in the United States and other parts of the world. Many different studies showing 300, 400, 500% increases in reports of bed bugs or reports of bed bug infestations.
Dr. Jerome Goddard, professor of entomology at Mississippi State University, knows a lot about these tiny human bloodsuckers and understands their resurgence is most likely due to international travel, immigration, and changes in pest control practices.
They're parasites. They suck blood. So they're brought into a place in somebody's luggage or belongings. They start living there. It has nothing to do with how clean you are. In some of the cases I've investigated, they've been five-star hotels.
But for all that's known about bed bugs, there's still much that's unclear.
We're not absolutely sure how folks react to bites because it's so unusual that we get large numbers of them into the clinic to study.
Some scientific papers say that bed bugs transmit human diseases. Some say they don't. Some people say you're supposed to throw out the mattresses when there's an infestation of bed bugs. Some people say you don't.
In an attempt to shed some additional light on these nocturnal pests, Dr. Goddard analyzed research from over 50 related investigations with clinical input from Dr. Richard DeShazo. The studies featured this week in JAMA, the Journal of the American Medical Association.
These research findings showed, 1, there's little evidence for human disease transmission by bed bugs. 2, human bed bug bites reactions range from none to cutaneous to occasionally or rarely systemic. And lastly, pest control of bed bugs or eradication is problematic. It's not impossible, but certainly difficult.
So while the red bumps and itching, the cutaneous reaction that may come with a bite, appear to be more nuisance than health hazard, experts agree a good look at the mattress you're about to sleep on is the best way to ensure that you wake up bed bug bite free. Haley Weldon, The JAMA Report.
Well, it just makes you want to go online and book a hotel room, doesn't it? I'm joined now by Dr. Bill Thompson IV. Dr. Thompson is a consultant in infectious diseases and travel medicine. He's also a member of the Orange County Medical Association. Bill, good to see you again.
Thank you. Good to be here.
Bill, bed bugs is a problem that really had been reduced to like a joke or a limerick, but they're back in a big way, as we just saw. How dangerous are bites from bed bugs?
Well, they're not dangerous in and of themselves, but it's more indicative of the big picture of an infestation at home. And patients really need to clean their homes, clean their beds, and do a lot of preventative. But it's certainly a problem.
If someone has been bitten and they're getting adverse reactions, what are some of the treatment options that are available to them?
Well, there's the over-the-counter cortisone cream is always good. You put it on, and it'll help with the itching and the symptoms. But the problem is they'll keep coming back because if you're infested, your home is infested, you've got to get to the core, and that's getting rid of the insects.
Okay, well, at home, obviously, we have control over that because we can call in a pest control company. We can tear out all the sheets and the mattresses and start from scratch and take care of the problem at home. But I guess, when we travel, of course, one of your areas of expertise is travel medicine. We've always been told that one of the first things you should do when you check into a hotel room is take the comforter off the bed, roll it onto the floor. Yeah. Are there other things that we should be watching out for?
Oh, you look at the cleanliness of the hotel, and sometimes that doesn't even matter. These bugs can get into your suitcase. They can get on your clothes while you're traveling on public transportation and so forth. And it can get into the carpet. But the beds are the favorite place because they do feed on blood.
Yeah. So they're nasty little guys.
Yeah. But they're not known to transmit infection, so that's good. Yeah.
So basically, we're talking about essentially a very uncomfortable but relatively isolated problem. We don't have to worry that they're carrying all kinds of diseases. They bite us. They want our blood, like you said, but they're not injecting something into us.
They're not. Unlike the mosquitoes that can cause problems like West Nile virus out here, no, they don't cause any problem.
You know, it's interesting because I've heard reports that, you know, you mentioned about the cleanliness of the hotel, but frankly, bed bugs have been found in 5-star hotels. I mean, how do we protect ourselves? I mean, we walk through it, do we instantly lift up the the mattress to look at the box spring? What do we do?
Well, how many of us really do that, especially when we go to these nicer hotels? But I suppose if you're worried, you know, you should check. And what are you going to do if you do find them? You know, you'd have to switch rooms. The rooms would need to be exterminated. It can be a problem. Are there any kind of, I guess, allergic reactions or really adverse reactions that you've seen with patients who have had I'll call it an encounter with a bed bug? Yeah, some people can have a quite severe allergic type reaction. That's why we use the steroid creams for it.
Okay.
Absolutely, but I've never seen anybody actually go into anaphylactic shock, no.
Is it worse with kids rather than adults, or is it worse with elderly folks rather than people, you know, in their 30s or 40s?
It certainly can be a bigger problem in the elderly, especially those elderly who live alone, who don't have much in the way of family support. And then you have to worry, is it bed bugs, or is it scabies, or is it lice? These are all parasites that affect people, especially the elderly and those with lower socioeconomic conditions.
Dr. Bill Thompson IV, thank you so much. Dr. Bill, of course, is a member of the Orange County Medical Association. We appreciate you being here and giving us your insight on this buggy subject.
Good. You're welcome.
We'll be right